Right, so good afternoon, everybody. We're going to start the webinar now, and I think maybe there'll be a few more people joining as I do the introductions. So welcome to this webinar on healthcare climate transformation, from tools to investments for sustainable funding. So I'm sitting in Cape Town at Stellenbosch University with some colleagues who I'll introduce just now, but the webinar is organized in collaboration with the Climate Action Accelerator. So I'll introduce the speakers just now, but just to sort of set the scene. So my understanding in a way is that what we've done in this webinar is we've brought together different viewpoints on this topic. On the one hand, health systems are increasingly interested in climate resilience, especially in the African context. We're interested in climate resilience, but also, I think particularly in South Africa, we're interested in the road to net zero and mitigation. So we're recognizing that the health systems are increasingly interested in this, particularly in low and middle income countries. But at the same time, we need tools to actually assess climate resilience, to assess environmental sustainability, and to come up with implementable action plans, things that what actually practically needs to be done, and what are the tools to help us identify those actions. So we've also got some climate experts in the room and some expertise on the tools that are available. But in addition, of course, once health systems have the tools and they have the plan, they actually need the money to put all this into action. And so we also have in the webinar some financial expertise. We've just had this global conference in Cape Town, the FIX conference, Financing in Common, which has brought together actually in Cape Town a huge number of the world's development banks. And one of the things that they, of course, have been considering is how to fund sustainable development. And so we have somebody from the financing, from the development financing sector also. So trying to bring these strands together, how can we bring the needs of the health system, the financing, and the actual creation of practical action and bring it all together and actually make it happen. So that's my assessment, my overview of the objectives of the webinar. So actually, my name is Bob Mash. I'm a professor here at the university. In fact, you're sitting, or we're sitting anyway, in my division of family medicine and primary care. And we have 4 panelists today. The first panelist to speak will be Agnes Sukat, who is the head of health and social protection for the French Development Agency. So she is coming more from a financing and development perspective. Then on my right here at the end of the table, we have Levani Naidu. She's the Deputy Director for Climate Change and Utilities Management in the local Department of Health and Wellness in the Western Cape government. So she's going to be speaking a little bit from the health system perspective. Then on my immediate right, we have Alex. So did you say Robert or Robert? So my first name's Robert, so it's very confusing. Alex is from the Climate Action Accelerator. He's the senior manager for health projects, and I think he will be speaking a little bit more about the actual tools that are available to help us with this. And then finally, online, we have Chit Sohal, who is the senior lead for international strategy at the Center for Sustainable Medicine at the National University of Singapore. But I've also discovered that she has a background in healthcare without harm and has done a lot of work in East Timor and the Philippines. And so she's coming as something of a sort of global expert in the whole climate change and sustainability conversation. So each of these speakers is going to get 10 minutes, which hopefully will be 10 minutes to speak. And then at the end of that, we will then have hopefully about 30 minutes for discussion and questions from people online and people in the room. And then at the very end, Bruno Jochum from Climate Action Accelerator will have some closing remarks. He is their executive director. So I think it says here that there was going to be a welcome address as well. Do you want to say anything from the Western Cape government?
Well, firstly, I'd like to welcome all our guests online and in person, and especially to Alexandra. Welcome to South Africa. And the Western Cape is a beautiful place, as you can see, and I hope you enjoyed your stay here. And thank you for collaborating and choosing Western Cape to host this interesting webinar that we are going to proceed with. Thank you.
Great, thanks so much. So we're going to start with our very first panelist, which is Agnes Soukat from the French Development Agency. And I believe that, Sonia, you have, I don't know whether you're going to use slides, but if there are slides, you will be putting them on the screens. Okay, no slides. Right, so Agnes, over to you.
Thank you very much, and good afternoon to all. Do you hear me well?
We do, yes.
Fantastic. As the climate crisis is only expected to worsen, the demand for scaling up funding for climate and health, and more broadly for environment and health, including biodiversity loss, with more resilient health systems has never been higher. Despite the urgency of this agenda, current investments in climate, environment, and health are extremely low, however. Only 0.2% of bilateral and multilateral climate adaptation finance has been committed to health projects, which is just under 5% to health activities overall, in a decade of climate adaptation financing from 2009 to 2019. Meanwhile, the loss and damage agenda is stalling, and much needed investments in healthcare infrastructure is not happening. This underfunding leaves the world unprepared for emerging health challenges linked to climate change. And in many ways, the world is not better prepared today in 2025 than it was in 2019, just before the COVID-19 pandemic. Additionally, we see it around the world. The health sector, as well as overall government budgets, face significant fiscal pressures and that hinder investments. This is very clear in the hospital sector. Hospital infrastructure is the public facility with the highest emissions, and at the same time, the first to be confronted with the consequences of climate change. Despite COVID-19 demonstrated strong capacity of hospitals for resilience, we are not capitalizing on this experience, and we don't see the kind of renewed commitment to investments in health infrastructure that would be needed if we would really take home the lessons of the COVID-19 pandemic. In most countries, these investments are still considered a rather low priority in the investment strategies of global health and financial institutions. With reduced international development assistance that is now being confirmed for 2025, stronger collaboration among public development banks as an alternative to mobilize large amounts of public finance is essential. With their unique capacity to mobilize a wide range of actors to come together, public development banks are key to impulse synergistic financing to stimulate climate and health action, ensure continuous health access, and protecting vulnerable populations in the long run. Public development banks are those financial instruments that serve public investments and public policy. Leveraging public development banks' collaborative investments is a powerful tool to pave the way for health systems transformation, marked by their climate adaptation and mitigation capacities, which is crucial to ensure a continuous health access and protecting vulnerable populations in the long run, as climate-induced health impacts are projected to intensify. So what have we learned over the past week in the Finance in Common Summit, which brought together all the public development banks in the world, which are more than 530 of them. And this meeting of this network of these 530 plus public development banks at this Finance in Common Summit really served us as a reminder that while the health and climate agenda has been established at international meetings, at COPs, at G20, its true operationalization remains extremely slow and extremely based on small-scale projects. Three messages need to be shared. First, the collaboration of these public development banks to synergize and mobilize their funding is a key step to align with the Paris Agreement and achieve the Sustainable Development Goals. According to the ILO, there is a USD 78 billion gap in financing to meet target 1.3, implement nationally appropriate social protection systems. And according to WHO, a US dollars 300 million a year to achieve 3.8, which is to achieve universal health coverage. These are core elements to strengthen populations' climate readiness and resilience. Yet, if only 10% of the investment capacity of all Finance in Common members, these 500 plus public development banks that mobilize 2.3 trillion a year of public financing, if only 10% of this investment would be channeled to this agenda, this would represent 250 billion health investments annually, which will largely cover the majority of this financing gap and mobilize domestic financing to this effect. To mobilize this level of funding, and that is the second take-home message, we need to build in common an investment agenda, not only at global level, but mostly at country level. Such agenda are preconditions to leverage funding, especially towards international partners, and mobilize global climate finance. To operationalize the agenda, and that's the third message, we need to structure coalitions between funders and implementers. We need to align investments. And that's why we created, together with more than 15 public development banks, a health and climate platform that is led by the World Bank, and in which the Development Bank of South Africa is very active, but is also joined by many public development banks in the world, including regional development banks such as the African Development Bank, the Asian Development Bank, the Inter-American Development Bank, and the China Investment and Infrastructure Bank, which is the largest public development bank in the world. Yet, external and development aid funding will only be effective if it is directed to strengthen domestic financing and domestic budgets and investments, and leverage the domestic funding towards better investments in adaptive and resilient health systems, including the strengthening of hospital infrastructure and pharmaceutical and health products supply chains, which are also extremely large emitters. To this purpose, tools do matter, and we need to express and orient funding in climate and healthcare, and we need to strengthen the role of data-driven decision-making. To do all of this, tools and methods need to be further refined. We often lack them because the health climate agenda is still for us a subject to be explored. So we need to further refine them because we need to build a relevant investment agenda that is based on needs and evidence. And we need to think about how to best allocate money made available to these investments. How do we also develop financial instruments that provide incentives to leverage domestic resources instead of substituting for them? That will be a lever for the ecological and resilient transformation of healthcare systems. I will openly share a few needs. First, we need consolidated health climate data at global and country level on both epidemiological indicators and healthcare expenditure. Thinking about national health accounts that include climate markers, for example, would enable us to invest in the same direction. We also need to integrate tools that enable us to make accurate diagnosis of the level of emissions and vulnerability of healthcare systems. We need to also measure how investments in climate mitigation and adaptation contribute to health, even when these investments are made outside of the health sector, for example, in water, in agriculture, or in mobility investments in transport. We need to share the best practices in designing adaptation and decarbonization strategies for healthcare systems. And finally, we must be able to translate these needs into investments and bankable projects that put a figure on them and implementation mechanism. Many of these tools already exist, but the international financial institutions need to find their way around this ecosystem of tools in order to build investment trajectories. More work is needed, and this is really what we work at in this platform of health and climate investments with public development banks. Finally, like all innovative agendas, tools and instruments often come from the field. We need to develop that bottom-up agenda and share and scale up the experiences that prove effective at country level. Right now, we support this initiative of future of hospitals and health systems towards adaptive and resilient health systems investments to respond precisely to this objective, bringing together the networks of finance, expert, and hospital practitioners to exchange good practices and innovation coming from the field, and to equip banks to ensure that our investments will be useful and transform the systems. The organization of this webinar is one more step towards getting to know each other better to work on this agenda, and it's really a starting point for sharing local initiative and a concrete experience between decision makers and making these initiatives known by this consortium of finance in common development banks that are working at mobilizing these billions and trillions towards the health system and the health and climate agenda. Thanks, finally, to the Climate Action Accelerator for driving this momentum, and to all the organizations that run this platform of future of hospitals and climate and health. And thanks for all our South African partners for organizing this webinar. Thank you very much.
Thank you very much, Agnes. And just to remind people before I move to the next speaker, that you can post questions in the Q&A. So put them there, not in the chat. And your questions will be monitored and we'll get to them at the end once everybody's spoken. So I'm going to move now to Levani Naidu from the Western Cape government for her presentation on, I think it's the road to net zero.
Yes.
Yes. I think there are some slides. Yes, there we go. Over to you.
Thank you, everyone. So I'm just going to touch briefly on our climate change race to net zero action plan, which the title is currently under review now because it's climate change in general. And it is a healthcare transformation that is taking place currently in the Western Cape. Moving on to the next slide. So I'm just going to touch on the definition, which we all know about, and then I'm going to zoom in onto where we are at with regards to climate change in Western Cape. And then I'm going to highlight on our strategic objectives, our policy initiatives, and then just to give a brief example of what we've done from policy to practice. Next slide, please. Okay, so as you can see the definitions on your left or your right and my left. And then on the right-hand side is a diagram. And what I always tell people is that climate change is inevitable. It's not going to disappear. So what we need to do is build climate resilience. And in the diagram, you can see it's through mitigation and adaptation measures. And that's something we have been doing as a province. Next slide, please. Okay, so in the image on your right and my left, this just basically shows our health services in the Provincial Department of Health. We've got corporate health services, which looks at our infrastructure, makes sure everything is running in order for our health services to be implemented for the people in Western Cape. And when we were doing research on how to go about this, this action plan, we found that research has shown, conducted abroad actually, not locally, that the health sector is responsible for 5% of the greenhouse gas emissions. And when we delve deeper into dividing as to which part of the health sector does our greenhouse gas emissions come from, it's actually from our health infrastructure. 70 to 80% of our greenhouse gas emissions emanates from our health infrastructure. However, health systems do also have an impact on the environment and climate change because there is an interconnectivity and a relationship between the two. So there's two things we thought of at the brainstorming stage, and that is to create awareness amongst the human health aspect and the environment of the interconnections between climate change and human health, and then start by creating initiatives and implementing interventions that are sustainable and cost-effective in our health department. Next slide, please. Sorry, next slide. Thank you. I'm just going to go quickly through this diagram. This is just basically an infographic that was extracted from the World Health Organization's operational framework for building climate resilience and low carbon systems. And as you can see, there's an interesting relationship between human interactions, the environment, exposures not only on humans, but also our systems, our food system, health system, energy systems, and our water systems. And then that all is linked to our health outcomes. If each one has an impact on the other, and that's how you get our health outcomes, such as your vector-borne diseases and zoonotic diseases, together with a whole range of other health outcomes listed at the bottom. And then we've got our health systems and facilities on the side, which also has a direct impact. It's mainly our scope 2 emissions, which are indirect emissions as a result of our healthcare activities. Next slide, please. Thank you. So Western Cape has joined the Global Green Healthy Hospitals Initiative, and that is an international network of hospitals and healthcare systems around the world that's committed to reducing their carbon footprint and promoting public and environmental health. And then to zoom in on that, we have also become members of the Race to Net Zero, which is a global campaign that was initiated by the United Nations Framework Convention on Climate Change. And that entire framework or network mobilizes a coalition of cities and regions. And just recently, it was opened up to the health sector in participating through the Healthcare Climate Challenge. And one of the challenge is to reduce our carbon emissions by 30% by the year 2030. Next slide, please. So this is just some of our awards. This was before I could even join the Public Health Directorate. You can see there were gold and silver awards received by the Western Cape for their input on Healthcare Climate Challenge in 2020 and 2022. And then on the extreme right, on my right, you'll see our Race to Net Zero membership certificate for 2024 to 2025. Next slide, please. Thank you. So this is actually a draft cover page of our action plan. And well, the title is going to be changed to our climate change action plan because there's far more that we are doing than just on the 10 global green healthy hospitals initiatives. And these are some of the documents and policies that have informed our plans, our action plan. And we've added elements, as you can see in the narrative, on emerging and re-emerging diseases related to climate change. And one of our key highlights is to promote the One Health approach for the mitigation of the impact of climate change within our province. And then most importantly, research and development in the climate change arena. And our plan, we are hoping to have it launched by April 2025. Next slide, please. So this is just a diagram of our strategic objectives. It's very generalized, but it's specific to our plan, where we are aiming to have an integrated collaboration between public and private stakeholders and partners to inform our decision making. Resource mobilization, where we can allocate resources for interventions and people management, and also climate resilient activities, where our activities are aligned with our action plan and strategies that will form part of that. And then finally, once everything is done, to track our progress, because it's very important to understand whether what we have implemented is actually working for us as a province. It's not a one-size-fits-all type of plan. It's specific to Western Cape. Next slide, please. So this is just some of our key policy initiatives. So it's important to also collaborate with other departmental and national stakeholders. So our department sits on 4 committees, of which one is a national committee, that's our Climate Change and Health Steering Committee, and then we form part of the Research and Technical Subcommittee. And then the 3 other committees are based within the Western Cape province. One is an interdepartmental collaboration with the Department of Environmental Affairs and Development Planning. The other is from our own health department, which is our Climate Change Committee that ensures we implement our local strategies. And then our One Health Steering Committee. This is a big one because we have the head of departments of all 3 departments: Environmental Affairs, Development Planning, Agriculture, and Health, sitting together at the table to discuss our cross-sector collaborations. And we are hoping to use this as a vehicle to drive our climate change initiatives. Next slide, please. So from policy to practice. So while this plan is being developed and finalized, parallel to that, we also have our activities and key initiatives that are being taking place in alignment with our action plan. And that's the installation of our alternate healthcare risk waste disposal systems, which has reduced our healthcare risk waste cost and output by 50%, procurement of green chemicals in our laundry facilities and our health infrastructures. We're currently piloting food gardens to ensure sustainability at 2 of our districts, 2 out of 6 districts, and we're hoping that can inform our food policy in the province. And then lastly, installation of solar PV panels and hybrid inverters at our hospitals and clinics. As you know, our electricity situation with Eskom is a bit dicey at the moment. We thought it was over, but then we got hit a few weeks ago with stage 6 load shedding. So this has come quite in handy. It also has assisted to reduce our cost as well. Next slide, please. So in conclusion, we are currently consulting our expert directorates and sub-directorates in the health department with regards to our action plan, because it is cross-cutting throughout the health department transversely. And then we will amend and finalize it. And that will be routed off to our head of department for signature once it's been finalized by our director and chief director. And then we will launch it in April. Thank you.
Great. Thank you. Virtual applause for you and for Agnes.
Thank you.
Thank you very much. So just to remind you to put your questions that you might have for our speakers as we go along in the Q&A. But I'm going to keep moving. And our next panelist is next to me is Alex Robert from the Climate Action Accelerator. So yeah, do you have slides?
Yeah,
Okay.
My colleagues will put the slides online, I guess.
Okay.
Thank you, Bob. Thank you, Levani, for hosting me in Western Cape. Very appreciated, and I'm very impressed by your work. The presentation was very good. And yeah, thank you, Agnes, also for the introduction. We were together with Bob at the Finance and Commerce Summit last week. Before I introduce my presentation, I want to say that the WHO guidance that Levani presented before is key in our work, the operational framework to building climate resilient and low carbon systems. That's the first tool we invite you to consult. And I know that we have some WHO colleagues online and registered. And another introductory word is to say that the Climate Action Accelerator is also a member of the UN Race to Zero. Yeah, so we partner already there. Voila. I'm going to present today, it's the first presentation of results from our research collaboration with the French Development Agency and Agnès Soucat's team, with Camille Perréan and also a colleague of him, Yara. And so I'm going to introduce a bit this research collaboration, what it is, what are the objectives, and then we'll zoom in on a mapping of tools. Like I think I won't repeat what Agnès said about how much tools they matter for all the different stages of implementation, from baseline assessments to strong evaluation of impacts. And so this project, it's called research collaboration because it's a pilot, and core in this pilot is to develop a toolbox. You can see that as an experimental product. That's why it's research collaboration. Next slide. I forgot to say the title, but it's about transforming healthcare systems, and we both have the two legs of adaptation and mitigation. I'll explain a bit more. So the scope is climate transformation. We want to develop climate resilience and low carbon models at both facility and system level. And the target audience of this project is at system level, what we call healthcare systems management teams. People like Levani in a province or a region, people in Ministry of Health, or you know that there are also other type of systems in private sectors or NGO-based or charity-based. So everybody managing systems of different facility and facility levels are the first level of the target. And second level is more at facility level is hospital directors and their management teams. We're talking here about facility management for the people in charge of, I would say, the hardware of an hospital. It could be also a head doctor or head of nursing for everything about healthcare professionals and or healthcare workforce and healthcare services. And we have three levels of objectives. First is to develop this toolbox where that's the step we are at this moment. We're also developing an operational methodology. So the toolbox is an access to different tools, and you can have a pathway to access them. And the operational methodology is to accompany users or teams to navigate this and provide technical assistance along the way. So develop a plan like you, but you don't need assistance for that, but maybe further down in the implementation, I'll give a few examples. Second objective that we're starting now, that was one of the objectives of my visit, is to start to support partners in South Africa. So we're already engaging through a pilot project with the Western Cape province. We also want to discuss at the national level, as we discussed together with Levani. The key purpose here is to see how useful is our toolbox and operational methodology and relevant. And since, as I think Agnès said, we need a bottom-up agenda of scalable good models. Here we want to showcase a model of how to bring together climate action with the right tools and supporting the right projects on the ground with the right planning. It has started in September 2024, and it will finish in December 2025. Next slide. So quickly, the results of the tool mapping. We have much more to say. I could just give an overview today. So what we see is that in this agenda, climate resilience and low carbon models, that excludes part of the sustainability tools that are already mapped somewhere else. So we have mapped so far, thanks to my colleague Sonia Rossman, who's on the call here, we've mapped more than 130 tools. So we have now a systematic database established. And we document key attributes of each tool, how to access them, which level, facility or system or both, and different categories. Do they target baseline assessment, energy, MME, cost, finance, etc. And some of the key findings that we see a very strong increase in publications since 2021. I think it's 3 times what was before, more or less. And almost 90% of the tools, they have no geographical focus, but they're very general. So first result of the gap analysis is that we lack context-specific tools. Some countries have led the way, such as the Philippines or the Fiji. They've adapted some WHO guidance in their own national agenda. But to bounce back on what Agnes was saying, we need more of local adaptation because our systems, climate realities are different at a very granular and local level. Over half of the tools, they focus on mitigation rather than adaptation. And we know that in low resource settings, probably the adaptations agenda is stronger. So there's a gap here to address. And one of our key messages is to say we need to combine mitigation and adaptation and frame it as comprehensive climate action. Both go together at global level and even very local in the facility. The key actions you implement, I can give examples, but I think Jit will give examples later. The key actions, they serve both purposes with the logic of co-benefits. If you have solar panels, you reduce your footprint, but you're also less dependent from the general grid and some cuts in the system. And last, in terms of thematic and categories, we see some gaps in finance, cost, and health prevention and promotion. So finance, there are links to 3 funds, the Adaptation Fund, the Green Climate Fund, and the Global Environmental Facility, but there are nothing really specific. For cost, there is a bit of cost effectiveness analysis, but we don't have something very developed, for example, for a hospital or for a system level. And last but not least, though a lot of tools they exist in health prevention and promotion on specific diseases, there are no specific tools of saying this climate sensitive disease in this country or in this context that high levels. So there is a bridge to make between existing health promotion tools and more specific. Next slide. I see that I have 2 minutes left, so I'll go rather fast on the overview. So that's these are pictures of the current design of. It's the first version of our digital toolbox. So you see there is a search bar. What we've put under is the level of implementation, facility or system. What we call maturity level, you could call it also programming or projecting phase if you are assessing, planning, implementing. And the building blocks, they refers to categories of WHO of climate action. There are examples later. So next slide. Then it's a classic, like a classic repository of tools. You have some filters to refine results and to sort them. Here is the example of our climate and vulnerability and capacity assessment. Next slide. And so here is the interesting things. Depending on your need, you can tick different boxes and end up with the list of tools that are fitting your needs. And I'm going to give 2 examples later. Next slide. So the first user case we want to show is that, let's say you're a hospital director, you want to understand the vulnerabilities and capacities linked to climate change in your facility, or also the carbon footprint, and you want to plan priority actions. So that's how you will tick your filter options. And for example, you end up on our climate vulnerability and capacity assessment toolkit, or also some carbon calculators that are listed here. One of them is the Aga Khan Development Network carbon calculator that you will find on WHO repository of resources. Next user case and next slide. Another one is a person working in a national or regional health authorities. Let's take the example of Levani here. So you already have a plan. Your needs might be to explore funding opportunities for implementation of climate action and some thematic operational tools. So you would enter these toolbox filter options and you would find both resources like how to access the Green Climate Fund, and WHO is doing a lot to promote this kind of financing facility. Or you could also find a generic tool for energy, if that's your priority, on energizing health, which is the WHO, World Bank, and other partners tool here down to the right. Next slide. So there are many more user cases that we've identified. We're trying to prioritize them according to the needs of our partners. And the next steps of our project is to finalize the digital toolbox. It will be available probably around end of April. And there will be a user guide that people can access to help them navigate this toolbox. We're finalizing, related to that, an operational methodology and a capacity development program. So that's more for direct support to some partners in using the toolbox. And yeah, our ambition is to conduct such assistance support approach in South Africa with you again and with the national level. And along the way, we'll continue to document and disseminate the approach and key lessons learned. At the moment, we're preparing a publication on the systematic mapping of tool. And by the end of the year, we hope to present more about the usefulness of the toolbox. Thank you very much. I'm sorry I took a bit too much time.
You're forgiven. No, well done. So we're going now to our last speaker and then to questions. So I'm going to hand over to Jit Sohal. Have you got slides as well?
Yes, thank you, Bob, and thank you, everyone. I hope you can hear me well.
We can.
Perfect. So I want to share a little bit. I want to focus my presentation on my experience in a project that I did together with a team from Healthcare Without Harm in Timor-Leste on climate vulnerability assessment for a project that was done with the WHO and the Ministry of Health there. But before that, I just want to, next slide, show that I used to work for Healthcare Without Harm in Southeast Asia. It's its regional climate manager, but I recently moved about 6 months ago to the Center for Sustainable Medicine at the National University of Singapore. And this is just basically an intro slide on what we do. And if you want to learn more about what the center does, we have a website that I'm sure should be in the last page of my presentation. And then next slide would be the start of my start of the information about Timor-Leste and our experience there. So this is a project that we did in 2023 with the WHO. And as Regional Climate Manager of Healthcare Without Harm Southeast Asia back then, I was tasked to lead the planning and delivery of this project with the WHO and the Ministry of Health there. It's basically, next slide, the goal is to, the objectives is really to understand the vulnerability of select healthcare facilities in Timor-Leste, and from there, develop recommendations for policy strategies that need to be implemented in Timor by the national government, by the Ministry of Health, to improve resilience and environmental sustainability of its healthcare system. So there were two major outputs or reports that were part of this project. One is the vulnerability assessment report, and the next one is the policy and strategy report. I'm going to talk mainly about the vulnerability assessment report and some of the things that were involved, the tools that were used there, and how it led to policy and strategy, and how it led to now securing financing, MOH Timor-Leste securing financing for implementation. Next slide. I'm not going to talk about this a lot because this has been mentioned by the previous speakers, but this is basically the core and the framework where the project is based on, which is the framework of the WHO on climate resilient and sustainable healthcare facilities. Next slide. I want to talk very briefly on the context of Timor-Leste. Timor-Leste is a low middle income country in Southeast Asia. It has about 1.4 million people. It's faces very high disaster risk levels, and have very high poverty as well, and other socio-economic challenges that it, largely because it's, one of the youngest countries in the world, and it has a very long history with conflict. The health system of Timor-Leste is largely public and primary focused, and healthcare is free for all Timorese, but there are a number of issues when it comes to access, delivery, and quality of care. But despite all of these challenges, the Timor-Leste government, the Ministry of Health in particular, has been really proactively addressing the climate change and health issues that it's facing. They've committed to the priorities that are in the COP26 health program in 2021. They've developed the Health National Adaptation Plan. They did this project to understand the vulnerability and hopefully prioritize actions that they can implement, and have started implementing initiatives that will improve sustainability and resilience of its health system. And so it's, despite all of these challenges that they're facing, the lack of resources in terms of providing healthcare, really it's I would say it's one of the really aggressive countries in terms of addressing the issues of climate change and health. Timor-Leste, although it is quite small, it also has a lot of varying geographical and environmental challenges. So when we were asked to do this project and to do the actual assessment, next slide, we made sure that, when we're looking at these healthcare facilities, we're looking at the different levels of care in different geographical areas of the country, those in the mountainous areas, those that are, in coastal areas, facing really different challenges when it comes to disasters and environmental challenges, to really capture the risks and the vulnerabilities that these health facilities and their population face. I'm not going to go into detail about what these health facilities are. The reports, I'm going to talk about where you can access them later, but they're publicly available if you want to learn more about the details of this project. Next slide. Just want to briefly talk about how we executed this project from the Healthcare Without Harm side. So there's a lot of desktop research and document review, trying to understand Timor-Leste in its context and its health system, trying to familiarize and become experts in a sense of the guidance for the guidance that WHO produced, the checklist that accompanies that guidance, so that we can propose a good approach and methodology for the assessment and policy development that we then co-developed with the WHO and the Ministry of Health in Timor-Leste. So every step of the way, there's always a consultation, because none of the team members that led this project from Healthcare Without Harm are Timorese or have, done any work in Timor-Leste. So we're really coming in as outsiders, and we want to make sure that in every step of the way, we understand the context, and we're able to adapt to the context and tailor it to the context of the Timor-Leste system. So after co-developing the approach and methodology, we started drafting, piloting, and fine-tuning the instruments that will be used for the assessment. And I put a star there because there's a lot of things that were involved in developing the instruments or the tool, which I'm going to talk about in a little bit. And then it led to data collection. And as we were, we thought, the instruments that we prepared were already good, but when we went to the field, we realized there are things that we need to adjust. So there were, again, refinements as we learn in implementation, and then processing and analysis of all of the things that we've learned from the ground, from desktop review, from document review. And sense checking every step of the way with WHO is our understanding correct? Again, we're doing this as outsiders, so we wanted to make sure that there's that whatever we're doing is grounded on the context and of the system. And then writing the assessment report, validating that, and then the assessment report then led to the development of the policy development or policy strategy report through consultation. Next slide. Just very briefly in terms of the data collection. There's a mix of quantitative and qualitative methods that we employed. And I believe the CAA approach is basically similar in terms of combining a checklist type of tool and an Excel sheet with like more KIIs, interviews, or focus group discussion. So I'm not going to go into so much details about how we did each of these. Next slide. Just in terms of developing and finalizing the instruments, so there were a number of steps that the team had to do. We really, as mentioned, had to understand what the Timor-Leste health system looks like from afar, not being there in person, because also there were limitations in terms of funding for the project. So we could only go there during the actual field visit. We weren't able to do anything or have consultations in person beforehand. So we had to do most of this virtually in consultation with WHO and MOH virtually, drafting the instruments, validating that with MOH, finalizing, and then data collection. Next slide. Just this is, I think, one of the most important parts of the project is really adapting the tool of WHO, because the WHO checklist that accompanies the guidance that they released in 2021 is really extensive, and its purpose is really to be adapted and to be tailored. It's not supposed to be taken to a healthcare facility and used as is. The WHO doesn't also recommend that. So there were a number of steps that we had to do as a team to adapt, tailor the checklist itself for Timor-Leste. One, the checklist, if you look at the checklist right now, it has about hundreds of questions for each of the hazards. So it's divided into like different hazards. So what we had to do is we reviewed the original checklist. We considered the language, the format, the structure of it. We identified, based on our desktop research and talking to WHO and MOH, and based on actual data from the government of Timor-Leste, what are the climate hazards in each of the districts where we're going to do the assessment. And what we did, instead of having separate hazard checklists for each of the facilities, to combine the questions for the hazards that are relevant to that specific area where we're doing the assessment. So there were, if you look at the checklist, I'm sure some of you have, there are a number of questions there that are repetitive or redundant. So we made sure that we integrated those questions or removed some questions that we think are not relevant for the context of Timor-Leste. And then we started with the highest level of assessment, which is the tertiary level hospital, prioritized the questions there from the original checklist, based on relevance and understanding of a tertiary hospital or tertiary healthcare facility in Timor-Leste. And then from there, we simplified the language. Some of the languages that are being used in the global tool are not something that you would hear in a language that's being used in Timor-Leste. And then translating that entire tool to Tetun, which is the local language of Timor-Leste, which also was quite challenging because some of the Timorese people speak Portuguese, some speak Tetun, so we had to settle to one language. We couldn't have more than 2 translations of the checklist. So we were able to still do it, and I think Tetun was the language chosen by the Ministry of Health to do the assessment was really the right way to do it. And then we were able to validate the checklist with the WHO and MOH. We were hoping to pilot it beforehand, but we couldn't do because of time constraints and the financial constraints when it comes to travel. But that's what I mentioned earlier. When we did the data collection, we first did the hospital, and then we realized, okay, there are some things that we need to adjust in terms of our approach. We needed to explain some of the questions to them instead of just giving them a checklist and then, okay, yes, no, maybe. We had to go and really explain to them what the question meant, because some of these questions are not really did not really translate really well to the local language. And so that's what I meant earlier when I talked about refinement. But I think this process of adapting, it took a lot of time for the team and a lot of effort, but I think it's really, really crucial. If we didn't do it, we probably would have not gotten a really good quality data from the actual field visit. Next slide. Just wanted to show you what the checklist looked like, a snapshot of it. This is one part of that checklist, and I believe it should be publicly available, how the Excel sheets for this as well. Next slide. Just in terms of the results, we did have, you know, qualitative and quantitative data that helped us informed us in putting together a list of priority strategies and actions that the Ministry of Health will need to prioritize, need to implement in the next couple of years. There's about 16 policy strategies categorized for each of the 4 fundamental key areas of the WHO framework that are in the current policy strategy report. And as you can look in the left, the table there, that's basically the quantitative result of the assessment that we did in the 10 hospitals, 10 health facilities in Timor-Leste. In terms of that finding of the assessment report, there's obviously a pattern, and most of the primary care facilities are the ones that have the highest vulnerability, and almost all of these facilities actually experience, for example, power interruption 2 to 3 times a week. So their level of vulnerability is really high. And we found out that some, and if not most of these are being driven not by the Ministry of Health of the health facility, not internally caused by the health system, but external factors and other actors that are supporting the health system, for example, power and the energy issues that are being faced by the Timor-Leste.
So we've got about another minute or so. Yeah.
Yes, I am almost done. So the intended outcome of these 2 reports is really to enable Timor-Leste to secure financing. So now they are in the process of securing a GCF project, specifically on climate resilient and sustainable healthcare. And the policy and strategy report and the policy strategies that are outlined there are influencing what will be in that project under the GCF. And that link there is where you can access the reports for this project. And my last slide is the next slide. Just like a reflection of, why we do climate risk vulnerability assessment or climate vulnerability assessments. I think as a principle, these assessments, these tools are really valuable and useful only if it drives and if it leads to system improvement and overall resilience. Because a tool can be there, and you can do the assessment, but if it doesn't, if the planning and the prioritization doesn't happen after that, then it's not really as useful. So I think in general, this is probably true to some, if not most of these tools and the assessments and planning for climate change and health, is that these assessments, these baselines lead to strategic prioritization and planning, including governance and securing financing for that implementation of those priorities, then leading to implementation and delivery and monitoring and evaluation that should either, can lead to another round of vulnerability assessment and understanding whether you were able to address or reduce the actual risks and vulnerabilities, but also can inform maybe a redo of your strategic priorities or your actual implementation. And I think I missed to put, or maybe just the PDF didn't capture this, but there's a very important cross-cutting layer to all of this, is that's governance and multi-sectoral coordination that I think also Agnes was mentioning earlier, that it's really important that different agencies and different funding sources collaborate, and that we ensure that financing,
Yeah, I think we're going to have to try and wrap up.
All right.
Can you make a final point? Yeah.
Yeah, I think that's it. Thank you so much.
Okay. Okay, thank you very much. Okay, there we go. So now we're going to have some time for some discussion and some questions. So I think Sonia Russman, who I think is sitting in Geneva, I think you've been monitoring the questions. Looks like there's at least 9 questions. So maybe the bulk of people are online. So let's start with our online participants, and then we'll come to the room and look for questions in the room. So maybe Sonia, give us 2 or 3 questions, and then we'll go to the panel for some responses.
Okay, perfect. Yes, we got quite a lot of questions here in the chat. I will start with the first one from Theolin Gentile to Agnes. You have mentioned a platform hosted by the World Bank and gathering several international funders. Can you please precise the name of this platform? So that's the first question. And you want me to read a couple more?
Yeah, let's take, say, 3 questions and then we'll, yeah.
Okay, perfect. Dr. Seding Kuala Sherzat asked, given the unique challenges faced by private hospitals like Mutahar Curative Hospital in Afghanistan, such as limited access to reliable infrastructure, specialized equipment, and consistent funding, what innovative, sustainable financing models beyond transitional grants and loans can be implemented to support climate-smart healthcare initiatives and ensure the long-term resilience in healthcare facilities in climate-vulnerable regions? That's the second question. And one more from Nick Bass. The world is being carved up among powers who are hungry for natural resources and openly declaring this. Where does this leave the green agenda for Africa and the world? And how should the health system network respond? So I'm going to stop here.
Yep, thanks. So I think really the first 2 questions were sort of more directed, I think, at Agnes. So maybe we'll hand over to you for a response. Agnes, you're muted and you're also invisible. Hopefully she is still with us. Agnes, are you still there? Okay, I'm not seeing any response. Maybe one of you have got a...
I can read out a question to Levani, and we can come back to Agnes if she comes back later.
I can give a bit of an answer on the platform, I think.
Okay, all right.
From what I know, so there is, so last week at the Financing Common, we were presenting on education, social protection and health, and that was part of the Coalition for Social Investments. So linked to that coalition, there is a climate and health group. So that's part of the Financing Common coalition. So you can find financingcommon.com, I think is their website. So that's one aspect. There is another climate and health finance group that is linked to WHO Alliance for Transformative Action on Climate and Health, where WHO, the French Development Agency, the World Bank and others, they discuss finance priorities, but at the attached level, it's more targeted to the member states and other NGOs. So there are these 2. Final answer is this webinar is also part of our initiative with the Geneva Sustainability Center, French Development Agency, Aga Khan Development Network, Chaîne de l'Espoir NGO, and ourselves. And there we have a working group on climate resilience, let's say, another one on finance. So we also discuss that as part of this Future of Hospitals agenda, where the target is maybe more towards hospital managers and directors. I hope that answers the question. Thank you.
Great. I'll try Agnes one more time in case she's agree. Agnes, are you back with us? Maybe she's gone off somewhere. Okay. So actually the last question was a very broad one. I'm not sure if anybody is able to address that. It was essentially sort of the race for net zero versus the race for resources in Africa, and which one is going to win, or are they even in competition? I don't know whether anybody wants to talk about that.
I can try and answer it since it's very broad and climate change is very broad. So I'm speaking from the Western Cape Health Department perspective. And as you know, I mean, South Africa, we are based in South Africa, and South Africa is in the continent of Africa. I think it's important from our experience to look at the existing resources you have. So it is specific to each country. I think even in South Africa, it's specific to each province. And also it's important to have stakeholder engagement. So I understand like the question, one part is like there's a competition for resources and the green agenda as well. So I think if you have one vision in terms of your resource allocation, and then also your local green agenda, and then you have a buy-in from all your stakeholders, I surely think that you won't have, or you should not have a competition, because at the end of the day, at one stage, climate change was firstly something philosophical. Now it's actually become a science, and there's evidence that proves that, you know, the greenhouse gases are impacting on the ozone layer of the earth. So we have to look towards a sustainable future. And that can only happen when there's one vision and you get a buy-in from all your stakeholders to say, hey, look, we need to work together and we need to allocate our resources collectively towards a vision for a sustainable future. I hope that answers. My question's a very broad answer, but
good enough for now. It's a very difficult question. Should we just come into the room? Are there any other questions in the room from anybody, from our panelists? I've got one, so maybe I'm in the room, so I will ask. And then we'll come back online. I heard a lot of talk about hospitals and the need to look at hospitals and, you know, the resilience and the environmental issues around that. But of course, you know, we're sitting in a division of primary care, and I did hear from JIT that actually, in your assessment, primary healthcare was the most vulnerable to climate hazards, and it's also, of course, the part of the health system that is most accessible and maybe has the most potential impact on the community climate resilience. So I'm just wondering, are we kind of overly emphasizing hospitals? Are we neglecting a focus on primary care as an important, or primary healthcare as an important part of the health system to look at in terms of this work? I don't know who's going to answer that question.
I can start.
Are you okay?
Or maybe Jit, you want to go first?
I can go first very briefly. I think primary healthcare is the way to go when we talk about climate resilience. I think strengthening primary healthcare systems will do so much in terms of resilience building of the entire health system. So you're absolutely right, Bob. I think the focus, and I think we're seeing it right now, there's a couple of projects in this region that are focused on primary healthcare system and strengthening primary healthcare systems in Asia and Southeast Asia, with like a focus also on vulnerability and like environmental sustainability, because really that is where people, that's the first line of defense. And that's if you have strong primary healthcare systems, you have strong community healthcare resilience, community health resilience. So I think it's really a crucial part of building resilience of the system as a whole. Thank you.
Okay, let me go back to Sonia. Sonia, you want to take us to another couple of questions?
Yes, of course. So we have a question for Levani, very straightforward question. What tools did you use to estimate greenhouse emissions in your hospitals? And then we're gonna have another one to Levani from Chepo Mokadi. With other recognitions and awards, what impacts does these incentives have on employees, patients, and community?
Okay, great.
Okay. So my first question with regards to the tools. I was appointed in December. I'm not sure if Dr. Karwa is still,
I can answer that.
you can answer. Dr. Karwa is still in the line, but online, he is my director. But from the time I have come in, we have not implemented any tools as yet. It was initially taken from an assessment of where our hospitals are at with what they have. And I think the load shedding situation, the cutting off of electricity in South Africa at different stages is what actually pushed us into moving towards our energy resilience. And then from there, we started looking at our waste disposal system, because we also have waste prohibition that is coming up in 2028 in South Africa, where we will not be able to dispose of certain categories of waste at the landfill site. So we still are in the process of using tools to use for our greenhouse gas emission counts. And we're also looking for a method as well to calculate our local carbon footprint emissions of our healthcare facilities as well. So yes,
Maybe I
Professor
can
Mash,
add,
you
I
can
can add,
yes.
yeah, so we were actually invited or asked by the sub-district manager or one of the sub-districts here in the Western Cape to do a carbon footprint of the primary healthcare facilities, which we did. And the tool that we used was the tool that Healthcare Without Harm have available on their website. And it's actually relatively straightforward. There's also fantastic sort of video instructions and a manual, so you can more or less teach yourself to do it. And that carbon footprint actually for primary care came out with an amount of 10, I think, equivalents of ECO2 per consultation, per primary care consultation in that sub-district. And that would be compared to, say, in the UK, the amount would be somewhere around 66, almost 7 times more, actually. Of course, actually the largest part of the carbon footprint was scope 3, and particularly the supply chain and the use of metered dose inhalers for asthma. So metered dose inhalers actually stood out dramatically as a contributor because of the very, very high potency of the gases that are in those inhalers. And the supply chain also was largely due to pharmaceuticals. So in fact, the pharmaceuticals were in some way the biggest contributor to the carbon footprint. But anyway, back to you for your second question. Yeah.
Second question, the impact of these awards. Okay, so these awards that were received post my appointment, they actually were specific to our energy consumption. There was a certain type of threshold that you are not supposed to exceed in terms of your energy emissions. And that's how the Western Cape did receive an award, because every year you have to input your energy consumption, water consumption. And it's not just only the climate change sub-directorate. There's a whole big team that's behind all of this. We have our provincial electrical engineers, mechanical engineers also involved in this as well. Incentives. Us as a province, we do not receive any incentives, neither do the hospitals. It's just a voluntary initiative that was undertaken to join the race to net zero to ensure a more sustainable future for the province and the people that live in it. So there is no incentive. I'm not sure if maybe I'm misunderstanding the question, but yeah.
I would say that from the point of view of some of the managers, there's an indirect cost incentive. So, for example, if you improve waste management in the operating theatre, you save money on waste management.
Yes,
If you install solar and you reduce your ESCOM bill, you're literally saving millions that can then go into health services. So there's that sort of incentive.
Yes, sorry, maybe I was misinterpreting it. So yes, we do have those type of incentives where, for example, the installation of our alternate healthcare risk waste disposal system, it has saved us over approximately 50% of our waste disposal, because healthcare risk waste has to be treated before it gets disposed of.
Maybe you should tell people what you're doing, because it's quite innovative.
So there's this machine, it's called an alternate healthcare risk waste disposal system. It's installed at approximately 10 of our hospitals, and we are rolling them out in our other hospitals as well. This machine actually takes our hazardous medical waste. It's your non-atomical medical waste. So your gloves, your shops, as in your needles, your shops containers that's inserted to, and then your gauze, your plasters. It puts it into this, the operator puts it into this machine. It is not an incinerator. It uses a process of heat and up to 160 degrees Celsius, depending on the requirement to process this waste, and water. And it actually converts this waste into sterile, non-medical waste. It actually comes out looking like, like how you get fibers on clothes, like pieces of fiber, or like fluff, so to say. It looks like that. So this waste is actually, can be categorized in other countries. It is categorized as general waste. But here in South Africa, they still are, according to our National Environmental Management Act, that comes from our Department of Forestry, Fisheries and Environment. They are still categorizing it as medical waste. But half our cost has been reduced because we no longer have to treat medical waste. And our medical waste has actually reduced. So where every week medical waste would be going out, we now only take medical waste out of the hospital once a month. So that is quite a big reduction. And we are limited to approximately 500 kilograms of waste being produced per month. But we actually don't even need to produce that amount of waste because everything is already, converted into sterile waste, general waste, actually.
Great, thanks. Sonia, back to you. Have we got any more questions?
Yes, we have many more questions. I don't think we have time to answer all of them, but thank you for this active contribution. I'm gonna address one more question coming from Camille Perron. So he's thanking for the presentations and he's asking, could you specify the tools used in the Cape Province and Timor to convert the assessment of needs, vulnerabilities into quantified investments?
Okay, maybe that's one for you, Alex.
No, but it's in the
And Jit as well.
so first, Camille is our main collaborator on that research project, and I think his question is directed to Jit and Levani.
Thank you. I actually already linked and shared with Camille on the Q&A section the link to the tool, so she can go through the tools that were used and like how the process, the exact process that we used and implemented in Timor. And I'm happy to share the slides as well to the participants, and Sonia Macarena should have it. So I'm going to pass it on to Levani for her insights and response.
Yeah.
It's the same as my previous answer. We have not yet implemented any tools. it's basically our policy is still in the process of being finalized. So hopefully in the near future, we can, make use of the tools to implement and then further adapt our policy in our monitoring and evaluation phase. Yeah, thanks.
And I just to tag on to this, that you showed us that website with all these tools that you can search for. Is that a live website or is that still just a mock-up?
No, yeah, it's a mock-up for the
Okay.
moment, so it's a
Okay.
beta version, but very soon it will be accessible. I don't know what you shared, Jit, but I cannot view it. Like you have many tools that give a part of the answer, but I think we can do more in having something more systematic that we can adapt in different contexts. And maybe I take the advantage of speaking. I wanted to complement the answer on the primary care level. So I fully agree with what Jit said earlier, that it's the first line and that's key for climate resilience. And what we see in the work of the Climate Action Accelerator, where we pilot some projects. So we see really a need for operational models at this level. We have more and more expectations and demands from our partners to work at this level. We work with you at Cederberg. We're launching a project in Bangladesh in a refugee camp in Cox's Bazar at that level too. And another one we're launching in the south of Senegal, same primary level. And what we see in the context of Senegal is that it's not only important for climate resilience linked to community resilience as Jit saw, but I would go even beyond. It's a very good level to operationalize transdisciplinary actions, such as in the One Health and planetary health approach, because in Senegal, that's what we're doing. We're linking also with the agriculture sector, the environment sector, to have a really comprehensive approach of all the healths, I would say, One Health or planetary health, to build more, like I would say, planetary health action at all levels.
Great. Let's try and squeeze two more questions in before we finish. Sonia.
All right. I have a question here, a general one about how you see the role of civil society organization in climate change and health.
Great. Give us another one, a second one.
Another one. Question for the panelist in charge of the Cape Province. How did you carry out the needs assessment? Did you use specific tools? What was the first stage in implementation strategy? Were there any obstacles?
Thank you. So the role of civil society organizations, who wants to speak to that?
I'll take that one.
Okay.
I'm the representative of NGOs around that table at that moment. I'm sure also Jit, you have some insights on this. So how do we see the role of civil society organizations or even NGOs in general? So I think it's key. On my example, in Senegal, for example, we work with a network of youth green volunteers. It's called Green Sedu. And I think it's key to sustain actions at local level. So the more we can involve civil society organization at the community level, it's good. And another example I would say is to bring as much participation of the community representatives in the assessments and in the priority setting, because if they are involved in the project making and development, there are high chances that there is a good ownership later, which is a key component of sustainability of any actions. It's not only specific to climate. Sure.
Thank you. So now the last question is over to you, Navani.
So I just received a message from my director. He's still in the meeting. Apparently, he has responded in the Q&A section. His name is Anwar Kawa. I'm not sure if he just messaged me now to say the response is in there.
Okay.
And he said also see the comment on the smart meter. So we do have smart meters in place, and we also have those smart meters. Just to expound on what he's mentioned is that the smart meters are installed in all our hospitals, and then we have a service provider that actually provides us with readings on energy consumption. I'm just touching in on the energy consumption aspect. So because you could say that is a tool that we have been using with regards to energy consumption, where we have a baseline that's created, and then we measure against that baseline to identify whether our consumption has increased or decreased after the installation of our solar PV panels in our hospitals. But if you're referring to tools in terms of checklists, we haven't gone through that phase as yet. It was more of a needs analysis in real time resulting in the development of the policy, and then also the appointment of me to run climate change in the province, which is very recent. Yeah.
Okay, no, thank you. Thank you, everybody. Thank you to all the panelists for responding, and also, of course, to everybody for being here and asking your questions. The final 3 minutes go to Bruno Jochum, who's going to make some closing remarks. Over to you, Bruno.
So thank you very much, and also to you, Bob Mash, for the great moderation of this panel. I think actually, you know, what this conversation shows is how valuable it is to bring, you know, health service providers with experts and also funders around the same table, trying to answer the question of how to operationalize in practice climate and health commitments, and how to accelerate and scale up. And what key takeaways can we take from the discussion? Well, first, there's a growing number of evidence-based cases around the world on how to transform health services, health systems. There are more tools available. It's important indeed to map them, to select them, and to promote them. I think there's a general agreement on really promoting comprehensive approaches, which are not siloed, but try to really combine both adaptation, mitigation, resilience within common actions and strategies, because that's what bring benefits to populations and to systems. There is a need, obviously, to do more to bridge certain gaps, and I think, and all of you pointed this, and it was well explained by Agnes Suka at the beginning. It's how to really, with a bottom-up approach, document better what are the costs related and benefits linked to potential investment plans, both at local and at national level. And I think here, this should be a call for actually, investing in the necessary studies and work to actually bring this to the table, because it will allow them to really make the link between in local experience, investment plans, and these funding streams through development banks that are probably critical in today's context, where also global health agencies and states are facing financial limitations. A word on the Future of Hospitals platform, which was mentioned several times. Just to say that it's a similar type of format with health providers, experts, and funders. So a platform created last year with the International Federation of Hospitals and its Geneva Sustainability Center, with the Aga Khan Foundation, with the French Development Agency, and a number of others, including ourselves, the Climate Action Accelerator, which is trying to really work on this operationalization aspect, and which is fundamentally an open platform, and which welcomes those who are interested to join and to work on these aspects together, and allow an active community of practice to take off. Finally, on the Climate Action Accelerator, maybe a word to say that besides what was presented by Alexandre in his presentation, just to say that we are not only eager to support more pilots at different levels and to try to actually bridge the knowledge gap with evidence, but also to extract lessons and see how we can contribute on capability building for more actors in an effective way and with really in a collaborative form, using the whole network of experts available for this, and it's something which we'll be happy to explain further and maybe on other occasions. And last but not least, I think this was a first webinar with these current actors. I think it shows that it could be interesting to go further. And I know the AFD is envisaging more of these webinars on climate and health, and I think it's an excellent format. Bring practitioners again with experts and funders to really try to scale up the move that we know is extremely needed. And I'll stop there. So thanks to all of you.
Thank you very much, Bruno. That brings us to the end of the webinar. Thank you to everybody for your participation. And yeah, we can now leave. Okay, bye-bye.